Yeah, I mean, there's a few points within that report itself. I mean, obviously the ones that I've just mentioned, obviously you've been talking about there. But there was obviously one of the other findings to do with the fact that a white applicant to a consultant job was more likely to be shortlisted and more likely to be successful at an interview. I think the relative likelihood was 1.53, I think it was. Can you explain why you think that is, and how potentially that could be changed, or how you think that may be changed?
Okay, so when I go back to when I started medical school in 1994, so some time ago now, I looked around the room. Half the medical student intake were probably women, and half were from an ethnic minority. We know from the current data, when you look at what the res are producing, is that medical schools these days are a fairly even balance. Junior doctors, we know that junior doctors in training actually have a disproportionately higher percentage of doctors from ethnic minorities compared to the general population. And yet, as soon as you get to consultant position, especially when you look at the teaching hospital super centres, that representation suddenly falls. Now, this is no way a reflection that for some reason ethnic minorities aren't successful enough, aren't good enough, but there's some kind of bias, there is some kind of block. But you also then look at the senior management structure. You look at your CDs, your AMDs, your medical directors, and talk about across the entire country. And again, those numbers fall once again. So there's clearly a separation that occurs at consultant level, because during training, junior doctors are pretty much protected by the deaneries, by Health Education England as it is now, or the deaneries as it was in my day. And during medical school, you're really competing against yourself. You're not competing against anybody else. But as soon as you get to that magic consultant position, it all changes. And protectionism, whether that's conscious or unconscious, suddenly changes. And that's the difficulty that we have at the moment, is that you still have that cliff edge where as soon as you want to go to that magic consultancy, the proportion of ethnic minorities and women drops.